Hey, Bob, so talk to us. What's one piece of advice you can give us this Monday morning?
As we discussed off the air, the one advice I can give you definitively is to join the American Dental Association. And that comes from someone who criticizes them on a regular basis.
So let me ask you this. Why join them and what do you criticize them about?
First of all, let's talk about the positives. I don't like to talk about negativity first. Everybody can improve things, right? So why should you join the American Dental Association? Because for 163 years, dentists like myself have contributed to building this huge organization. We are the fourth largest lobbying power in Washington, D.C. Think about it. Hospitals, physicians, all these physical therapists, all these healthcare organizations, we are the fourth largest. Representatives and senators and politicians know our lobbyists by name. So it is important for us to have proper representation. The government will bring different ideas to the table. There are a couple of them going on right now that we should be opposing, and we need to have a voice there. So if you do not join the American Dental Association, and if you do not contribute, do not just write a check and go to your offices and say they don't do anything. We need to get involved. We need to have a voice within organized dentistry. It's basically for advocacy. We're advocating for our patients first and then the profession. Our oath is to the patients and then the profession. So that's basically why we should join. Why do I criticize them? I don't criticize them to weaken them. I criticize them to make them better. Every time we as an advocacy coalition criticize them is an opportunity for them to correct things and be stronger and attract more people. For me, lack of communication between what the American Dental Association does and the members, that's been an issue. Also, lack of focus to what is important for the benefit of our patients and the benefit of the profession. I feel like we need to reiterate to them what is important so they can concentrate better.
So you mentioned that we need to participate more, not just cut a check and then, go back to practicing. But then you also mentioned there's a lack of communication. So do they even listen if we participate?
They are listening. I guarantee you that they are listening. I have this Facebook group, Dentistry in General. They are part of it. I have heard that they are listening and they are making some changes. Is it fast enough for most people? I don't know. That's why I have created this advocacy coalition that includes 30 people, past, present American Dental Association leaders and well-known people within the dental community to help guide them. We have a platform, a 6-pillar platform that we have presented to them. And we're going to be at the House of Delegates trying to contribute positively. I want everybody to understand we're not here to weaken the American Dental Association. This is all for making them stronger.
Gotcha. Okay. So it's more like we're just sometimes downhearted because it's not moving at the speed of our expectations.
There is a myth that the ADA can do everything. This is a capitalistic system that we live in, right? And there are laws and there are rules that when a dentist criticizes them that, oh, why can't we have the insurance companies pay more? That's not the job of the American Dental Association. That's illegal. We cannot collude to have another company pay us more. These are things that we cannot control. A lot of times dentists criticize the ADA for things that's out of their control. Obviously, they're struggling and they see their patients being affected. So we naturally want these things to happen, but we need to be realistic. The way we can affect all the things they want is by making sure we know what legislation to support, what issues we can push through the politicians through legal ways to make a positive effect.
Gotcha. So then what can they control in simple terms, and what issues right now do you see most trying to push?
Right now, two of the most important things is the dental loss ratio, which is identical to the concept of medical loss ratio that the Affordable Care Act brought for medicine we want the DLR for dentistry. Unfortunately, the ADA, in my opinion, agreed to a plan that is not what we should have agreed to. So we need to be outspoken and we need to be involved in creating the better dental loss ratio, the one that was passed in Massachusetts called Question 2. A lot of this information is on my YouTube channel and my Facebook group. So if people need to find out more and educate themselves, contact me, educate yourself. These are the most important things that are affecting our profession and our patients. That should be the number one thing. We advocate for patients first, not for ourselves. And the second thing is Medicaid laws are being ignored in every state. And people will say, why should I even worry about Medicaid? I'm fee for service. I'm a PPO. I don't take Medicaid. Medicaid laws dictate every insurance law that there is. As Medicaid goes, so does the private insurance.
Gotcha. So we should be focused more, especially if we're heavily insurance, but like Medicaid.
We shouldn't be focused on it, but we should look at states to enforce the Medicaid laws that are there. I have a YouTube video on this subject that goes into details of what it means. All we want is to prove to politicians that this is good for the patients and let's enforce it.
Okay. And so doing this, the first steps, if we're like, should we join, should we not join, is joining, right? Continue to join, continue to be a part of it. And then now, if we wanted to start having our input into it, we do what?
The alternative is what? Sitting on social media complaining about our problems, right? And what's going to happen? Nothing. Zero is accomplished by not joining. So joining and getting involved is important. And then support the coalition. Dentistry in General Advocacy Coalition will be out there presenting ideas. It's not a organization that collects money. I'm covering all the costs because I don't want people to think that this is a profit generating organization. This is to help younger dentists for years to come. We want to make sure the profession is protected and our patients are protected.
Gotcha. So right now, Bob, give me a percentage from 1 to 100. How much of a percentage do you feel protected and your patients protected?
Listen, we are fighting different wars on different fronts. The corporate intrusion into healthcare is something that everybody knows about. We have insurance companies, that's another corporation intruding into our profession and into our patients' well-being. So for me to put a percentage on it, I'm an optimist, right? I'm a glass half full. I say something that a lot of dentists roll their eyes at me. We are a lot like hairstylists than doctors. Why? Because you will drive 2 hours to see your hairstylist. The personal relationship dentists form with their patients is very important to them. So I still believe we have a chance of keeping corporate intrusion at bay. We can't prevent it. It's there. However, if you create this professional and compassionate relationship with your patients, they will travel to come to you, but they also pay out of pocket to be out of network with a lot of these insurances. So it's important to understand that. So I would say we're still 80% strong, my friend. Some people may be less optimistic as I am, but we want to make sure we keep it at 80% and we're not going to go down the road medicine took.
Gotcha. Okay. Awesome, Bob. I appreciate your time. And if anyone has further questions, you can definitely find them in the Dental Marketer Society Facebook group, but where can they reach out to you directly?
The easiest way to reach out to me or join my Facebook group is to go to my website, dentistryingeneral.com. There are 2 buttons. You can join the Facebook group. You can look at our event. And there is a chat button there that whatever you want to ask or comment, it comes right to my phone and we can talk.
Gotcha. And then you also have an event coming up, right?
I call it the Digapalooza. I try to bring speakers that are well-known and are all-stars. It's October 25th and 26th in the Chicago area. I say Chicago area because it's not downtown. It's 20 minutes away from downtown in an upscale mall. We have a very attractive lineup of speakers for 2 days. And for your listeners, as I told you, I still offer the early bird, which is $400 off, and I can give you the link that you can share with your audience.
Oh, we appreciate that, man. Thank you. So that's going to be in the show notes below, the information for Digapalooza, and at the same time, the early bird special. So thank you so much, Bob, for that. And I appreciate you coming by. And thank you for being with me on this Monday morning episode.
Thank you for having me.